Hey everybody, our project is titled Issues in Nursing Leadership, Understaffing.
My name is Daniel Warren.
I'm Brittany Potts.
Lolly McMillan.
Tiffany Little. The American Nurse Association defines appropriate staffing as a match of registered nurse expertise with the needs of the recipient of nursing care services in the context of the practice setting and situation. Appropriate nurse staffing is necessary to ensure safe and quality outcomes. Staffing and scheduling are not the same thing and should not be confused. Staffing involves planning for hiring and deploying qualified human resources to meet the needs of the group of patients. Scheduling is a function of implementing in the staffing plan by assigning unit personnel to work specific hours and days of the week. There are three main staffing models used today: budget-based, nurse-patient ratio, and acuity-based. In budget-based staffing, nursing staff is allocated according to nursing hours per patient day. The nurse-patient ratio model is based solely on the number of patients on a unit. A pure nurse-patient ratio approach to staffing might not take into account individual patient needs or nursing judgment. Acuity-based staffing considers patients' level of care complexity. Acuity-based staffing should take into account the scope of nursing and the time needed to maintain standards of practice. It must give nurses time to perform all functions within their scope. No single staffing model is best for all settings and situations. Most organizations use a combination of methods and tailor the approach to their specific needs. Concerns about safe staffing may arise when a purely financial approach is taken without considering such factors as acuity, outcomes, or research. Currently, the United States is experiencing a shortage of nurses and is expected to worsen by 2022 as baby boomers age and the need for healthcare grows. There are many factors contributing to this shortage. For example, nursing school enrollment is not growing fast enough. There is also a shortage of nursing school faculty. There is also a significant segment of the nursing workforce nearing retirement age. According to a 2013 survey conducted by the National Council of State Boards of Nursing and the Forum of State Nursing Workforce Centers, 55% of the nursing workforce is aged 50 or older. In addition, it is estimated that 1 million registered nurses will reach retirement age within the next 10 to 15 years. Lastly, insufficient staffing is driving current nurses to leave the profession. A study published in 2007 found that 13% of newly licensed nurses had left their first jobs after 1 year, and 37% reported that they felt like leaving their job. This is a brief video where the current nursing shortage in Georgia is discussed.
The American Association of College of Nursing says that by 2022, we could actually have a shortage of nurses, and that would have a huge impact on medical care in this country. News Channel 6's Derica Young joins us now live in the newsroom. And Augusta University's nursing school is working to put more nurses into the workforce and combat that shortage.
Nurses will be in high demand by year 2022, but the people in charge of the College of Nursing at AU say the demand is high now.
Definitely there is a demand for nurses, and it cycles. Sometimes the demand is greater, which it is right now.
People who are older particularly need to be worried because these nurses have such a broad role in healthcare.
There is a role for nurses in every aspect of healthcare. The Dean of Augusta University's College of Nursing says leaders thought that when the schools consolidated, more students would help alleviate that shortage, but that wasn't necessarily the case.
So we are growing in numbers, and we grew throughout the state so that we were graduating over twice as many nurses. Not enough.
The nursing shortage by 2022 could be 19%, but Dr. Marion says that could be happening now.
Well, it's here today. 2022, I don't know exactly where we'll be then, but clearly we've been dealing with a major shortage that seems to get worse almost every week.
Nurses are a vital part in the medical world, and they say it's important that they stick around. Leaders at that College of Nursing said the university is working every day to graduate more nurses and meet that high demand.
The nursing shortage, we are doing a lot of different approaches in the hospitals in terms of patient care, trying to maximize our registered nurse population as much as possible.
Why is understaffing a problem? According to the American Nurses Association, massive reductions in nursing budgets combined with the challenges presented by a growing nursing shortage have resulted in fewer nurses working longer hours and caring for sicker patients. This compromises care, the nurses' health, and morale of staff. Nearly 50% of nurse managers say understaffing is a significant problem in their organization. Inadequate staffing and long work hours result in health issues for nurses. These issues include musculoskeletal disorders, hypertension, cardiovascular disease, depression, and burnout. In a 2010 study, researchers showed a clear trend between frequent overtime work and incidence of heart disease. Burnout can be described as a number of symptoms including chronic fatigue, irritability, insomnia, headaches, back pain, weight gain, and high blood pressure. According to a study by the American Medical Association, each additional patient over 4 per nurse carries a 23% risk of increased burnout and a 15% decrease in job satisfaction. Aside from occupational hazards, studies show a correlation between inadequate nurse staffing and poor patient outcomes. Most nurses try their best to take care of patients, but there is only so much they can do. High nurse-to-patient ratios are associated with an increase in medical errors, patient infections, pressure ulcers, pneumonia, MRSA, falls, cardiac arrest, and accidental death. Every additional patient added to a staff nurse's workload is associated with a 7% increase in hospital mortality. A recent study in the New England Journal of Medicine found that the risk of death increased 2 times each time a patient was exposed to shifts with a below-target RN staffing.
When hospital staffing is inadequate and nurses are overworked from working back-to-back shifts, patient health and safety is compromised. Evidence shows that there are more drug administration errors, missed nursing care, and longer patient length of stay when nurses are overworked. Additionally, the longer the shifts are for the nurses, the faster they become burnt out and also dissatisfied with their job. So what can we do to help solve this problem? Well, one step that we can take to help solve the staffing issue in healthcare is by reducing the amount of overtime work and minimizing the number of back-to-back shifts by nurses. By doing this, job satisfaction significantly increases. Nurses feel more appreciated and feel like they're a part of a team. Not only that, but the same goes for the patient outcomes when the number of back-to-back shifts are minimized. Another thing that we can do to help solve the staffing issues in healthcare is by implementing an on-call nursing staff. On-call schedules can ensure and promote patient safety by determining and predicting the day's workload intensity. Having these non-traditional shifts could also be beneficial for older and more experienced nurses who may still work but need shorter shifts. One hospital even went as far as to implement a crisis staffing plan. The crisis staffing plan is fairly simple. If the unit is 2 nurses short, an offer of $100 will be offered to the day nurse and an offer of $150 will be offered to a night nurse. This kind of plan can also help make the nurses feel like they're more valued in the workplace.
All of these problems make it clear that there is a definite need for some kind of adjustment or correction. These problems aren't necessarily easy to fix and will require some effort to rectify because they are large-scale issues. An idea to correct the staffing issue would be to enact something similar to what Ohio attempted to do with the Ohio Patient Protection Act. This bill mandated that Ohio hospitals to impose a 1-to-1 nurse-to-patient ratio for patients in the ICU, critical care, OR, as well as for unstable neonates and patients needing resuscitation. A 1-to-3 nurse-patient ratio to pediatric patients and patients who are pregnant would also be required. This bill also imposed that hospitals publicly post these mandated nurse-to-patient ratios, as well as forbid overtime to meet staffing needs. This bill was eventually declined, but I believe that it had the right idea. I understand that there are financial aspects that have to be accounted for and considered to ensure the hospital's livelihood, but on the other side of this save money, stay afloat idea, it has to be understood that if the hospital is not performing as it is expected to, and allowing for high rates of falls, infections, medication errors, and even an increased mortality rate, then the hospital will suffer. If this is happening because nurses are stretched too thin or patients aren't receiving enough one-on-one nursing, then consequently the hospital will be the one held accountable. I believe that Ohio's approach would be the most conscientious because it ensures that patients will be looked after appropriately. We also have to deal with the issue of the nursing shortage across the United States. There is a high percentage of nurses that change professions after only a short time working as a registered nurse. There are several reasons for this happening, but there are some solutions that can help resolve this problem. One idea is that the hospital management should crack down harder on acts of bullying. This may sound like a light issue, but bullying definitely plays a role in nursing burnout. Giving out suspensions or something to that extent will give nurses incentive to stop any negative behavior or bullying. Another way to decrease the nursing shortage will be to focus on expanding the nursing faculty population. A way to do this may be providing more incentives like loan repayment or loan forgiveness for nurses who are willing to teach nursing students. With an increase in the nursing faculty, the limit for the number of students accepted into nursing programs will increase, and this will cause an increase in the number of nurses, which will help cut down on the nursing shortage issue.
As you can see, understaffing is a huge problem in the nursing world today. Before we embark on our journey into our future careers, we also wanted to gain real-world insight. Our group decided to conduct field research. We spoke with 2 registered nurses, one in Georgia, one in Tennessee, about the current understaffing problems that they may have faced thus far in their career. These are their stories. Understaffing is a significant issue in my department. In an attempt to handle the problem, administration has attempted to hire travel nurses to fill the voids. Understaffing does lead to burnout. I have seen it happen many times. Within the last year and a half, we have lost at least 15 nurses due to burnout and low morale. When understaffing occurs, patient care is compromised on several fronts. I work in the emergency department. When we are understaffed, we have to close rooms or entire zones. This increases patient wait times in the lobby. When the floors are understaffed, we can't move admissions up and out of the department. Admits take up rooms and therefore bog down our lobby. I feel that administration does listen to our problems, however, without being in the thick of things, they don't fully understand it. We present the data, but they don't feel the same emotional and mental fatigue that those numbers represent. I work on a cardiac, telemetry, stroke floor. I'm also floated to a post-op, surgical, general medicine floor quite often. Both are a 1-to-6 ratio. I come across understaffing problems every single shift, and that's not an exaggeration. Literally every single night when myself or whoever's in charge is doing staffing for the next day, we have to call the float pool and beg for extra nurses. Honestly, administration doesn't do much about it because of budgets. We, the floor nurses, are expected to pick up the extra slack. If that means taking 1 or 2 extra patients over our normal ratio, then they ask us to do that. I feel like it's a combination of things that really contribute to burnout. Understaffing is a big issue, but it's one that you will find anywhere. However, I feel that it's how administrators handle the situation that is the breaking point. If administrators don't care to correct the problem, then stress levels rise among nurses who are expected to pick up the slack. Another problem is that when you do get new faces, the burned out nurses find another job. It's like a giant revolving door, so the understaffing issue never really goes away. It's a vicious cycle. Patient care is most definitely compromised. You can't spend adequate amount of time when you have 6, 7, or 8 patients. Everything is still expected to get done on time. It's super easy to miss something, make mistakes, etc., because you're so busy rushing from patient to patient. I feel that the nurse-patient ratio depends on the floor you work on. With cardiac, telemetry, stroke being my main workplace, I feel it needs to be 1-to-4, based on the acuity and the risk of patient decline. There was one night I remember in particular that I had to start an amiodarone drip while having 6 patients, and it was a nightmare. No nurse can give necessary care when the ratios are so high.
So be the change. Get involved.